Who really controls your Medicare care? Understanding medical groups, IPAs, and chronic care in Southern California. Hi, and welcome to Medicare 360 show. My name is Jennifer Alfonso Lee, your host today, where we simplify Medicare so you could make confident healthcare decisions for yourself and your family. Today's episode may completely change how you think about Medicare because most people believe they are choosing an insurance company when they enroll. But here in Southern California, that's only part of the story. So today we're discussing what an IPA or medical group really is, how chronic conditions are managed under Medicare, why two neighbors with the same plan can totally have different experiences, how Medicare doctors and insurance companies work together, and what you must verify before enrolling or changing plans. So, if you or your loved ones live with diabetes, heart conditions, COPD, arthritis, or ongoing health issues, this episode is especially important. So, wanted to touch on why clients always tell me, "Oh, I hate my insurance company." And technically, it's might not be your insurance company's fault, right? It's your medical group and your doctor that might be the one that really is to be complained for. But many things like fall back on the insurance company. Okay, so that's a side topic. So, why is this topic really important? Healthcare is changing nationwide. Medicare is shifting from paying for volume to paying for outcomes, which should be the case. That means Medicare now rewards systems that prevent hospitalizations, coordinate care, and manage chronic illnesses proactively. And I would say that prevention of hospitalization is so important because hospital costs are rising and it's just quite expensive. So in Southern California, it happens to be one of the most advanced regions in this model. Not all states or areas, counties, zip codes have this model. So that's why in Southern California, it is a different landscape, probably more advanced. So maybe in other regions, it will eventually come there. And that's where the IPAs do come from. So, what does IPA stand for? It stands for Independent Practice Association. So, in the simplest way to understand it, Medicare funds healthcare. Okay. Um, the insurance companies administer the plans, and then the medical groups or the IPAs, the independent practice associations, actually manage your care. So while your um, card may show in an insurance carrier, your real healthcare experience is shaped by your primary doctor, your specialists, the referral systems, and the hospitals and the care coordinators. All of that typically lives inside your medical group. So this does surprise many seniors. So they say, I choose the insurance. Why did my doctor change? Often it's because the medical group or relationship changed and not the insurance itself. So while your doctor is equally important, their staff, their office manager are the ones really helping you push your referrals and authorizations in to the medical group to approve. Okay, and fortunately, in recent years, medical groups and insurance company contracts have been coming up for renewal. So, this is when they negotiate if they're going to stay working with each other. And unfortunately, based on differences or just cost or what they want in their agreement doesn't come into play, the medical group and the insurance companies do have to part. And there have been some major changes with big medical groups in Southern California this past annual enrollment. It really did change many clients because, particularly, they rather stay with their medical group versus the insurance company, right? Like if you are been with your doctor for such a long time and the specialist and that medical group, it is very hard to change, right? People don't like change in general. So either it's changing your medical group or changing your insurance company. And it comes down to it, it is still all about relationships, right? Although you may love your insurance company, you probably love your doctor and your specialist more, especially if they've been helping with your care for a long time. So how does chronic conditions change the system? Most Medicare beneficiaries have multiple chronic conditions. Unfortunate, right? So examples include diabetes, high blood pressure, heart disease, COPD, kidney disease, and arthritis. Under Medicare Advantage plans, especially plans receiving funding based on patient complexity, the process is called risk adjustment. So the goal is not to label patients as sick per se, but to ensure resources exist to manage ongoing care. This funding supports like the nurse outreach, the wellness programs, medication reviews, chronic care coordination. But there is an important requirement. Conditions must be documented every year, and that's why they're getting more strict on that. So, how does the verification process work? CMS process. Let's walk through what actually happens behind the scenes. Um, Step one is patient visit. You see your doctor. Your conditions must be evaluated, monitored, or treated annually. Step two is physician documentation. Doctors record your diagnosis, use standardized codes, and if a condition isn't discussed, Medicare may treat it as inactive. Okay. Step three, plan submissions. The health plan submits verified diagnosis to CMS, the Center for Medicare and Medicaid Services. So step four, CMS audits. CMS reviews documentation through the audits. If records don't support diagnoses, payments are reversed. Plans may face penalties, and of course, they don't want that. That's why you may notice annual wellness visits, home assessments, extra check ins. These are part of the national quality oversight. So, a lot of clients do say, Jennifer, like I got some reach outs, a doctor wants to visit me. While it can still be a scam, it may not be a scam. So, just caution on that and give us a call and we'll let you know if it's a scam or not. And then now let's talk about medical groups and how they differ locally, especially in Southern California. So, Model 1 is like an integrated system where large coordinated healthcare ecosystems are. Like the characteristics are they're centralized referrals, they have strong coordination, structured care pathways. It's really best for patients comfortable staying with one system. Okay, that's usually one large medical group. And then there's a model two where there's large multiple specialty IPAs common across Orange County and LA County. These are many independent doctors, broader specialty access, variable office styles, and community based care. So, often, sometimes there is like a large integrated, coordinated healthcare system, but they also may contract to individual physicians with their system. So they're kind of like an affiliate, I would say, of that system. And then Model 3 are smaller physician networks. They're often relationship driven practices. The pros on that is definitely personalized care, your familiarity with your physicians, but the challenges are referral speed can vary and fewer administrative resources. So, what I find on that is that sometimes if the medical group is quite small, it's harder to find like a specialist to refer you out. Sometimes they will refer you to a really great specialist, but it could be in a different county or it could be so much further. And sometimes they do have to do exceptions for their clients that way. So that's the thing on that. While you do have that more personalized care, if you do come across something specialized or a doctor that you need to see, it may be a longer time to see them further away, which are the cons to that. So let us go over some real Southern California case studies. So let's go over case study one, contract termination. A client received a letter stating their medical group will no longer participate January 1st. So insurance stayed the same, but the primary care physician changed, the specialists were set, and authorizations were started. So the medical group does often matter more than the carrier. So in this case, luckily, because it was January 1st, there was that annual enrollment period. Because sometimes it's very unfortunate when they have it mid-year when there's no enrollment periods. In this case, let's just say the client was out of the country, didn't read the mail, didn't know what's going on. When they came back, the insurance company did have to change their primary doctor, their medical group, and then your care got interrupted, right? So the nice thing is sometimes you definitely can change your doctor or the medical group, but let's just say that doctor and that medical group does not take the plan. You would just have to move to a different plan. We definitely are very, yeah, this, what was the word? Meticulous on helping clients make sure that their doctors and their specialists align to the same medical group, same network, so you don't have those issues in the future on that. And it's very unfortunate that there's just so many contract changes. Let's go over case study two, chronic care success. Orange County patient managing diabetes and heart disease. Okay, so their IPA provided nurse outreach calls, preventive reminders, and medication monitoring, and hospital visits dramatically decreased. So sometimes a doctor does get bonuses for you doing your preventive, your annual, like in the beginning of the year. So, I mean, it is in your best interest to see your doctor, but also, I mean, they also could be getting a bonus for that. But hey, that's a win-win for everyone, right? Okay. So then let's go over case study three, same plan, different experience. So, two neighbors enrolled in an identical Medicare Advantage plan. Different IPAs meant one had a smooth specialist access and the other faced referral delays. Same insurance, different healthcare systems. So, that's the thing when clients say, my neighbor has this plan, it's wonderful for them. Well, that may be the case for you, right? If maybe it's the same medical group, the same standard of care, which is awesome. But sometimes you do have different ailments, different chronic conditions, different medications. So experience and just your level of expectations may be very different. But of course, Yeah, listen to your neighbors and your friends and family, but also know that your situation could be very different from theirs, your preferences, how you want your care handled, just the bedside manners of the doctor and their staff, just really contribute to your overall experience. So not all situations are the same, but for the most part, 4-star, 5-star plans, of course, probably are better than 3-star plans, right? Just really depends on how you want your care from your doctor and their bedside manners in that as well. Okay, so how should beneficiaries verify coverage? So before enrolling, ask what medical group am I assigned to, right? Some tech seniors will just be like, hey, give me the website or give me a catalog. I want to search the doctors in there, right? So the biggest thing too, even if you are assigned to the proper medical group, sometimes, I don't know, computer generated ID codes like happen to be the wrong medical group. And that's the case, please, when you do get your new ID cards, you look at the doctor, you do look at the medical group to make sure it's correct, right? Because what we don't want to happen is you go to the doctor's office and you're not seen or you are billed, right? Because it's not covered. So that's one of the things that you definitely need to look at, which hospitals are included, right? So I would say on this, I just had a client last week was just like, I really like this hospital. But I was telling them that their doctor that they really like as well is not affiliated with that hospital. So, yes, emergencies, you could go to that hospital, no problem. It is in network, but your doctor and his medical group, not affiliated with that hospital, may want you to go to a different hospital for, let's just say, scheduled surgery or like a outpatient care. So just keep that in mind when looking at that. But definitely, if that is important to you, definitely have to look at that, right? Who are the specialists contracted? That's a big one. I just noticed smaller medical groups that do pop up, right? May have the doctors, but may not have the specialist in there. Of course, if you don't have any specialists, then hey, problem solved. You don't need one. But often, sometimes it's just so far. Clients complain about that. Something clients do complain about how referrals work, right? So the biggest thing is that doctor's office does need to do that referral. If the code's wrong, they forgot to input it. I mean, you're never going to get that referral. So watch out for the medical groups that are taking a longer time than ones that boast, hey, we'll send you a referral out within 24 hours and get that approved. And then what happens if contracts terminate? As your agent, we definitely will do as much as we can to help you in that pursuit of keeping your doctors and your specialists. Okay. So these are especially critical for chronic condition patients because if you are seeing a few specialists with your doctor, you just don't want to interrupt that care, especially if you already have appointments or labs or just redo of labs, right? It is very important. Of course, you just go once a year, then that's a little bit easier, a little bit stress-free for you. So really, those are the things. Other things to also verify from your coverage would be your dental plan. Not all dental plans are created equal, meaning these different Medicare Advantage companies have different vendors for their dental plans. And not every plan in that insurance company is the same. It could be a different vendor and it could be different coverages. So the biggest thing in regards to your dental coverage within your Medicare Advantage plan is first is that dental dentist like or the vendor, right, for that insurance plan. Is it an HMO, a PPO, a EPO, a reimbursement? Those are the things, right, to look at. If you have a particular dentist in mind, we could definitely help out to see if that's really your own main concern. The dental, we look at your dental dentist to see if we could find them in a plan. And then once we find the plans that they are in, we do a side by side comparison to which plans have the best or the most coverage for your dental. One thing to note on that, sometimes when you talk to your dentist, they're like, oh, we don't accept Medicare. And that may be the case, but embedded in your Medicare plan could be a vendor, right? And that's the thing, like you have to tell them the vendor because they are more aware and they're more familiar with the vendors in those plans. So keep that in mind as well. What other things should you verify for coverage? Eye doctors, right? Different from ophthalmologists and optometrists. But if you have this local optometrist that you love to go to, definitely look at that. Sometimes the portals are hard, or the websites are very hard to look for that optometrist. It's not easy. I mean, it takes me a little bit to find like an optometrist because it could just be in a different name, right? Of their store versus the name of the optometrist and things like that. So things are not easy sometimes when you're looking for like a doctor, a specialist, medical group, optometrist, your dentist. All those sometimes are not easy. And the other crushing thing is sometimes you like and love a doctor, but they're not taking new patients. They close their panel because they just have too many patients. So that's also something that's discouraging. So let's talk about the final takeaways. So in Southern California, Medicare Advantage, you're choosing a healthcare ecosystem, just not an insurance plan. Just keep that in mind. Understanding how Medicare, medical groups, and Center of Medicare services work together can really mean smoother care for you, fewer disruptions, better chronic condition management, and greater peace of mind. At Medicare 360, our mission is education first, helping understand how Medicare works in real life, right? So that's the thing. With our experience, we definitely could guide you to the right direction. We don't tell people what to do. We help guide, and based on our experiences on the past, we definitely advocate for clients to make sure that they are well taken care of, treating you like our mom or dad, our own, so you get the quality of healthcare that you deserve. So, thank you for spending this time with me. This is the Medicare 360 show. My name is Jennifer Alfonso Lee, your host, where clarity always comes before coverage. Thank you, and you have a wonderful day.